Hello, everyone. My name is Victoria, and I'm the mother to 6 beautiful children. My youngest daughter, Adeline, who is 6 years old, and my youngest son, Oliver, both have MLD. Adeline flourished as an infant and toddler. She developed normally until 15 months old, hitting all of her milestones on time, if not before. She was walking, talking, and so incredibly smart. Then one day, our entire world turned upside down. Adeline started falling and having trouble walking. I made it my mission to figure out what was going on with our sweet girl. This started our 9-month odyssey of numerous specialist appointments, misdiagnoses, MRIs, and countless hours of physical therapy, all during which she continued to lose more and more of the milestones she previously had mastered. We received her MLD diagnosis the day after her 2nd birthday. Within a month, she had lost her remaining milestones. Adeline had no treatment options available since she was too far progressed. We have watched as MLD has stolen more and more from her. She now suffers from chronic respiratory failure, seizures, is non-ambulatory, can no longer speak, and is completely dependent on us for everything. Oliver, however, has a much different path. Oliver was tested within 2 weeks of birth, and since Oliver was pre-symptomatic, he was eligible for gene therapy. Oliver, unlike our daughter Adeline, had a chance at life. Unfortunately, the only place we could receive this life-changing treatment was in Milan, Italy, thousands of miles from home. It meant a 6-month relocation for Oliver and myself away from family, which would mean missing out on precious time and memories, especially of those which involved Adeline, who was already living on borrowed time. We also knew that the treatment would be difficult. The thought of chemotherapy, months in isolation in hospital, and knowing Oliver would be immunocompromised was scary. But we had to do it. We had to give Oliver this opportunity despite the risks. We did not want to see him suffer like his sister. To potentially be able to live his life, not trapped inside his own body, free of seizures, and to be able to breathe without machines and constant respiratory therapies. Gene therapy could be his miracle, and we could not pass it up. On June 25, 2021, Oliver received LIBMELDI, also known as OTL-200, the life-saving gene therapy, which has been approved in the European Union, UK, Iceland, Liechtenstein, and Norway. We are now 1 year out from gene therapy and just recently celebrated Oliver's 1-year birthday. Oliver is followed by neurology, BMT, his team in Milan, physical and occupational therapists. He undergoes testing every 6 months with at least 1 yearly visit to Milan to assess how Oliver's body is responding to the OTL-200. I can tell you, without a doubt, that gene therapy has helped Oliver. While the therapy did not result in an absolute outcome, he is thriving and growing each day, and we are hopeful for his future. Oliver does have some delays, but has not regressed. Oliver turns 2 on October 20th, the day before this meeting. He is now the same age as my daughter was when she could no longer stand or walk. While Oliver has weakness in his legs and tightness in his left ankle, his latest nerve connectivity test revealed that it was stable when compared to the one performed when he was 6 months old. This means that during the time that Oliver should have been regressing and showing nerve damage, he was not. Instead, at the age of 2, Oliver is getting stronger, has started to stand up, and has now started taking steps on his own completely unassisted. Oliver does have a speech delay, which can very much be attributed to spending so much time in a hospital setting and also hearing 2 languages constantly during his formative months for language learning. However, he is gaining new words daily and starting to speak in 2 or 3 word sentences. He also has a bit of a hearing deficit and oral aversions, which we believe to be due to side effects associated with the chemotherapy he received. He is trying new foods and eating more each day. In comparison, Adeline could no longer speak, could no longer swallow without the risk of aspiration, and was G-tube dependent for her food at his age. We have no regrets about Oliver receiving the LIBMELDI gene therapy. To give Oliver the gift of time, to give him the opportunities never afforded to Adeline, there was never any question. While it may not be a cure, it changed Oliver's quality of life and is giving him a chance his own body would not have allowed. As a parent, I can tell you how completely soul-crushing it is to witness your child's body turn against them and watch their daily struggles to do things we take for granted each day. I would give anything to help my child, and I would be willing to try any treatment that it would improve the quality of life and slow down this awful disease. To be able to give my child more time to experience the life they deserve is everything.